So let's start. Good afternoon, good morning, good evening, and a very warm welcome on behalf of ISA and Bernard Van Leer Foundation to all of you joining us from all around the globe. Hope you are doing well, and we really do hope that life is kind to you even during these very challenging times. Color the World, Urban Response to COVID-19 Crisis is the title of our today's webinar. I'm Zorica Trikic, I'm a Senior Program Manager at ISA, and I will co-host this webinar with my colleague, Julian Vincelot. Can you wave, Julian? So people can see you. Coordinator at Urban 95, coordinator at BVLF. This topic is rather new for ISA. We recently started the PrimoKids initiative, which aims to mobilize cities and municipalities to develop a comprehensive early childhood strategy or comprehensive early childhood strategies. But for BVLF, this is a topic they are working on for several years. And we are going to share links to PrimoKids and Urban 95 with you in a chat box, but also with additional readings that will come to your inbox after the webinar. So we are all witnessing how the COVID-19 crisis changed the lives of the youngest citizens and their families. And it is clear for most of us, it's clear that more than ever, we have to come together, join forces in order to create safe and yet inspiring living environments for them. Before I introduce today's panelists, I would like to give you a few technical information. So during the webinar, we are going to have two polls. Today I'm saying pools, but two polls. And we are going to ask you to connect to www.menti.com and to put in the box the code 360096. But don't worry, we are going to repeat the code and the web link. You can do it on your phone, but you can also directly connect with Mentimeter by using the link that my colleague Teresa is sharing in a chat box. We are also going to ask you kindly to use the chat box to share your comments and also to use question and Q&A box for your questions. And Julian is going to monitor Q&A box, and we are going to come back to some of your questions during the webinar. The webinar is recorded, and we are also doing live streaming on YouTube. So let me introduce the panelists. It's a real pleasure to bring together people from so many different sectors and fields, people like urban planners, architects, and engineers to talk about using the early childhood development lenses when planning and managing public spaces, mobility, play spaces, and urban spaces in general. And we really hope that you're going to be inspired and that you will also gain some new insights and knowledge. So let me introduce Daniela Ben Attar. Daniela, can we have a small wave from you? Daniela is the Israel representative of the Bernard Van Leer Foundation, and she is responsible for developing and implementing a national strategy to improve opportunities for young children and families. Ankita Chakra, she is Senior Program Manager at NACTO's Global Designing Cities initiative, and she leads the Streets for Kids program, and she's going to talk about that later. Will Newton, Will, he's a senior researcher in ARUP's International Development Team, specializing in projects engaging with refugee and informal settlements. And Simone Battisti. Simone, wave to us. He is an urban planner, educator, and the director of Relationship Center from Albania, and he is working on urban and neighborhood planning. I also already introduced Julian and myself, but I would like to mention two people that you don't see, but they are, at least for me, crucial today. The people who are providing technical support, Teresa Moreno and Alyosha Rudash from ISA. So if you have any technical issue, please leave the message in a chat box and two of them will come back to you. And now let's start with the polls. Julian, the floor is yours.
Hi, thank you, Zorica, for the great introduction. Just checking, can everyone hear me okay? Yes, okay. So I'm seeing on the graph that you're already starting to answer the polls, as Zorica was saying. To answer this poll about where every one of you is joining us today to listen to this webinar, please go to www.menti.com on either your smartphone or on your laptop, and then use the code 360096, and you will see the question pop up on your screen. So the reason why we're making this specific poll is because we want to get a sense of the diversity of participants that are joining us today to listen to our four speakers and panelists. So I can already see some answers coming in. It seems like most of you are based in Europe at the moment, a few in North America, South America, some as well joining us from Australia or Asia, and Africa. And I'm sure we also have some people from the Middle East joining us as well. So maybe we can wait as well a few more moments to give a chance to everyone to answer this question. But anyhow, it's great to see the diversity of people coming to listen to this topic. This is a topic that crosses contexts and applies all over. So we're hoping that through the diverse perspectives of our panelists, we'll be able to answer some of your specific questions around the connection between early childhoods, urban environments, and in the specific context of COVID-19 that we're all faced with wherever we are. So as you continue answering, maybe we can go to the next slide. Great. So here, if you go to the next question on the same poll, you will see you can type in your motivation for joining this webinar, and we're very curious to hear a bit more about why you're joining us, why so many people from so many different locations, and we're sure with so many different backgrounds are joining us today. Great. So I'm already seeing some words popping up in the word cloud. Inspiration, designing solutions, children, cities, this makes sense. Insights, professional growth, sharing information, connecting, learning, exchanging. It's moving very fast, faster than I can read. Sharing our network, learning new things, interesting and cross-disciplinary. I like this one. I think early childhood is by definition, early child development as a sector is cross-disciplinary, and now we're connecting even further to another sector, which is urban planning and design. So very much so. Some people have experience in working in slums. Some people are interested in learning about streets for kids. Infant and toddlers, very much so. Design insights. Yes, so a lot of different things, but the main ones coming out are inspiration and learning, which is a great start. So hopefully, and I'm sure it will, this webinar will serve these two purposes. Feel free to, as Zorica mentioned, type in your question in the Q&A or make any comments that you may have in the chat, and we'll be happy to support you also with additional information and as well as relaying your question to the panelists. So I'll stop here for the poll, and then I'll give it back to Zorica.
I have to unmute myself. Thank you, Julian, and huge thank you to all of you. So let's start learning and inspiring each other. So you made a very important comment, Julian. Early childhood development is a meeting space, and what we've learned in ISA is that if you want to connect people across all the things that are dividing them, you just bring them together and ask them what are your dreams that you have for your children, and then miracle starts to happen. So I would like to start this miracle and learning with Daniela. Daniela, can you tell us something in general about the Urban 95 initiative, and especially about the most recent policy briefs that Bernard van Leer launched?
Yes, can you hear me okay?
Yeah.
Okay. Thank you so much, Zorica and Julian. We're very happy at the Bernard van Leer Foundation to have this chance to shine a spotlight on some of the most vulnerable humans in this pandemic. Of course, I said Bernard van Leer has been working on children in cities for quite some time, but in COVID-19, we see cities are even more relevant as crowded spaces that have been particularly hard hit. And it really allows this time where we're kind of still in the middle of the pandemic, allows us an opportunity to take stock, see what are some of the key challenges and what if solutions have been coming up in cities around the world that we can share with each other, adapt to our own contexts, and learn together. And while there have been many challenges, I think there's also been some interesting innovations and opportunities that we can see. So how has COVID-19 affected babies, toddlers, and their caregivers in cities? First, we've seen that inequalities have been amplified. And this is something that's been a very stark reflection of our society. From New York City to informal neighborhoods in Latin America, the vulnerable have been the hardest hit. We can also see that in the death rates. And of course, this has increasing significance for children under 6 whose brains are developing. Second, reduction of the access to support systems. So caregivers are more isolated. They don't have access to peers. They're lonely. Instead of having face-to-face support, we see people waving from windows or balconies. And also, even services, I've seen women who give birth during this time all of a sudden are sent home early and don't have access to antenatal care, for example. So this is one of the biggest challenges. And then finally, increased caregiver stress, whether it's due to loss of income and economic stress or anxiety and overall uncertainty during this period. So what are some of the ways cities are responding to these challenges? First, making sure that essential urban services and public goods are accessible to the most vulnerable babies and toddlers. So this could be basic services like sanitation. In Kigali, Rwanda, there's temporary sanitation facilities that have been put up in vulnerable areas, hand washing stations, for example. Public spaces where we'll hear later more about, where streets have been closed and car spaces have been removed to allow for more public space and social distancing. Access to nature and public transit, which is very important for the most vulnerable that can still have the opportunity to be mobile and gain access to their jobs and livelihoods while having special adaptations for social distancing. A second strategy is building resilience. And this is for now and going on for the next periods of this crisis. So often I think the most prominent is community resilience. So building communities of parents through social media and other means. Third, boosting support for caregiver mental health. And this has been a huge issue. We've seen all kinds of hotlines popping up and expanding existing hotlines, as well as peer-to-peer support. And mental health continues to be a big challenge that is often overlooked. Fourth is protecting women and children from domestic violence. So we've seen a spike, sometimes up to 60% in domestic violence during this period, and it's a huge problem. Some cities like France have, in France, have set up special centers for victims. In Madrid, they set up an interesting a kind of anonymous alert system in critical services like supermarkets and pharmacies that are still open. Women can go there and anonymously report domestic abuse and give their details for the local authorities to follow up, which has been working well and helped them protect themselves. Fifth, making sure families with young children can continue to get critical services. So childcare was one of the first to go, but many cities did keep childcare for the most essential workers in the market. Some childcare is now coming back. Early learning has much gone remote in many cases. And in some cases where there's no internet access, like in New Zealand, they've been providing television broadcasts with different kind of content to help early learning keep going when there's a lack of childcare. And finally, sixth is providing parenting services digitally or remotely when possible. So this is kind of online parenting coaching, telemedicine, and we have an example in Jordan where the Queen Rania Foundation has adapted its offline parenting program to WhatsApp, sending tips to parents and keeping them updated and giving them support throughout the crisis. So this was just a very brief overview because we just have a short time for this section, but on our website, you can find a very detailed brief and a lot of examples and links. And many thanks to Julian, who is behind that. So you can you can access that to get more information. Of course, we'll be interested to hear your strategies as we go forward with the question and answers.
Thank you, Daniela. Thank you so much. It sounds very scary when you look at this list. So can you tell us, like, more close to the field, close to the world, close to the real people? What did you do in Tel Aviv? What were your actions? What you did, especially related to neighborhood, urban planning and public spaces?
Yes. So diving deep into actually the field, exactly, and what's really been happening here. Well, we've been working for the past 3 years in Tel Aviv to transform the way that the city looks at early childhood from an invisible population to a strategic priority. And many of the principles we talked about over these years now all of a sudden gained prominence and new importance during COVID-19. So I'm going to share two areas where the municipality has been acting during COVID-19. One is through public space, and the second through community life. So we all know that how important outdoor play and nature is for mental health and child development. And when the shutdown began, there was only allowed for people to go 100 meters from their homes. So it was actually the public spaces closest to the home that gained the most significance. Rather than going to a traditional playground farther away, people went right under their buildings to spend time with children, meeting and playing. And we also saw people going on the rooftops for the first time, which was spaces that weren't used before because they were trying to find public spaces they could use that were within 100 meters that could be child friendly. So they were also doing this. And we also saw gaps for those who didn't have the opportunities that had concrete on the bottom or parking on the bottom. They didn't have any of those opportunities and they were cooped up in their homes, which was very difficult. So here we had an understanding with the municipality of the significance of proximity. So it less mattered what type of playground equipment there was, but rather was it accessible in the space restrictions of 100 meters? Did it have vegetation and nature and simple things? Did it have our community members there that we got to know? And so this is a principle the municipality wants to take forward, where all families should have a safe, green public space nearby. And this can be used by creating new uses in existing spaces that weren't being used before. They also took parenting activities that were done in community centers outdoors. So all the community centers closed and they didn't want to give up on these activities and they started taking them outdoors in small groups that adhered to the COVID-19 guidelines. So we can see some of those here. As in many cities around the world, and you'll hear more from Ankita later, cities began closing streets for public space. So this is something that had been in the strategic plan of the city for a long time, but actually the momentum gained during COVID-19, where more cities were closing streets, really provided an opportunity for Tel Aviv. They closed 11 streets during the month of May, and they took advantage But you see in the picture here, you see the parents they put a blanket on the concrete, which is a bit sad. Even if they close the street, how do you make it child friendly? It's not enough just to close the street, it's good. But how do you make it child friendly? So this is the design that they came up with. A simple, quick design that brings greenery, shade, places to sit and rest. And this has been already approved by municipality and construction is underway. So this is how we can really focus on our population of young children. I also wanted to mention something about the most vulnerable in the city, where there's around 40,000 asylum seekers and refugees that really experienced here, while everyone experienced economic hardship, here there was a humanitarian crisis because this is a population that's undocumented with no safety support and all of a sudden lost their jobs and actually needed basic things like food. And so there's no safe public space for this population. And here we have an indoor space we had created for therapeutic play, and you can see on the left, but on the right, you can see what happened during the pandemic. It was just became a storage for all this emergency food that the municipality delivered to these families who really were in dire need. And then when I go to the issue of community, so of course, as we've seen all over, a lot of the community support went online. So we had a lot of live online events on parent-child interaction. We adapted them for different minorities. So you see it on the right-hand side in Arabic, for example, in Yafo. A key demand wasn't only the parent-child interaction and ideas, but actually on reducing parental stress. That's something that parents asked for the most and wasn't something we had thought of. And actually, when the municipality was closed and people were sent home, one of the first people they brought back was someone to operate this mission of providing these remote services because the city saw how badly the parents and children needed them. But community life was also happening offline. So a key learning in Tel Aviv, and very interesting, was there was spontaneous community networking and support that started to mushroom throughout the city. So we know, unfortunately, in cities, there's often a lack of community and isolation, and people don't know their neighbors enough. But all of a sudden, when we're stuck in our buildings, people started to get to know their neighbors. They started building new networks of support, helping each other with challenges of childcare and parenting. And there were also intergenerational connections. So on the right, this is a story that one of the parents told me, where there had been an elderly man who every morning in the building had always watered the plants, but everyone's always a rush to get to preschool in the morning. No one had really noticed him before. And all of a sudden the young kids saw him there because they were there every morning, and they started watering the plants with him. And this was so nice for him to be with these children and for them to have this kind of calming grandfather figure. So we saw these community networks forming, and the city leaders said, we see the spontaneous networks. How can we sustain this and turn it into more of a strategic structural response going forward in the pandemic? So they came up with a very interesting strategy where they're leveraging the support to create community networks. So their existing municipal management has a community manager for every 150,000 residents. But this was too wide. It doesn't allow you to really focus in on special needs of young children, minorities. So now what they're doing is really taking small segments of these communities and putting them into very much smaller units, like a block or a building or a small neighborhood, where community activists are identified and recruited, and they're in charge of this small community network or segment of a couple hundred people. And they get their phone numbers, they have a list, and they're building the infrastructure to have this community cell ready to go when there's a crisis. They can operate it, they can get help from each other. So in the next crisis, if there's a lockdown, someone has a baby, all of a sudden you can operate your immediate environment, get everybody activated to help, to bring food, etc. So it's really trying to build this community resilience and these small community networks. The other adapted learning going forward is from the public space. So the public space activities they decided to make into a series of parenting activities. They call them parenting under your home. So they call them capsules. So it's about 8 to 10 children with parents on all different workshops and activities. And these aren't just done for anybody. They're done within these community networks I told you about. So each segment, the parents would be from their segment they were assigned. So you're achieving two goals. One is strengthening the community network and neighborhood, and also the parent-child interaction. So one really feeds into each other, and they're trying to expand the strategy. So just in closing, I know there's this saying, it takes a village to raise a child. And I think one of the most interesting things from Tel Aviv is that the way the municipality was looking at the grassroots activity that naturally and spontaneously took place, and the need for community support, and how it's building on that to create and build stronger communities that it can support for young children and families who so much need that support now in the pandemic and going forward. Thank you very much.
Thank you so much, Daniela. It was really inspiring. And you just made me think that we can have a new saying. It takes a crisis to see obvious. Something that we were advocating for so many years, and people were saying it's not doable. Now it is. So we can add this to our dictionary or our idioms and phrases. So now I would like to go to Ankita. Oh, I like your background, Ankita. You're in the middle of the streets of New York. Ankita, NACTO started the Streets for Pandemic and Recovery Response program. How does it look now? What it means? We know when it comes to streets and transportation, it was always about safety. But now safety is something more. It has much more layers than before. Can you tell us something about
Sure. Thank you, Zerka. And I think I'll also start with a little bit about background about NACTO for those who are not familiar with NACTO, and get into what we did for Streets for Pandemic and Recovery and Response, and then a little bit about Streets for Kids and how that's still at the heart of everything that we do. So can everyone see my screen? Yes? Okay, great. So let's see. So NACTO Global Designing Cities Initiative, most of you may have come across some of the design guidance that we produce, which is really a visual way of looking at policy and practice and just design principles. And it's something that's now become accessible for not only planners and engineers, but is also very accessible for community advocates, for politicians, for anyone and everyone who's interested in streets. And with GDCI, the global part of it, we've been working all across the globe under different umbrellas, whether it's road safety, whether it is streets for kids, whether it is just helping with sustainable transportation. But with all these cities, our focus has always been streets. And this focus is very intentional because what a lot of people don't recognize is that streets is one of the largest network of continuous public space in our cities. In fact, it's one of the biggest public asset that cities have. It's almost sometimes up to 30% of the area, which does belong to public. So when we work with cities, what we really focus on is really helping them reimagine the space and reclaim the space for uses that are more sustainable in terms of mobility, but also in a way that it can give back to the people for active and vibrant uses. Now, obviously, you can tell this picture was before the pandemic, but I think as Daniela mentioned, the need to reclaim the space in our communities still stands true. It was true during the pandemic, and I think it will be true even as we are recovering and looking at building back. I think for the US and where I'm based in New York, the pandemic brought a lot of suffering. There were a lot of lives lost. And I think that we cannot deny like how painful it has been to be in this phase. And to Daniela's point, it also highlighted a lot of structural inequities in our city systems. And I think with the lockdown, what was kind of interesting is that cities recognize that there is this need to focus on the hyper-local access to open space like they did in Tel Aviv, right below the buildings, to making sure that the cities were providing safe walking and biking as options for hygienic and affordable mobility for essential workers. So this is a picture from where right outside, well, pretty close to my home. And to me, I think for urban planners, like while we were kind of grappling with this reality, this new reality, it was also a very interesting time to observe that how people were taking back their streets, even places where cities weren't providing or were providing the very basic minimum. In this case was just a barricade, that children and caregivers were out on the streets. The traffic volumes were low because of the lockdown, so people could actually use the street. And the amount of children and those, Daniela Daniela talked about intergenerational relationships that I saw within this neighborhood was something that I had never seen before. So there were some positives in what we were seeing in our cities, including like like improved air quality and lower noises, which I think is very helpful for mental health, amongst other things. And then, of course, there was a shift in travel patterns. What was interesting is that often cities are based with this idea that people go from home to work. And now with the lockdown and the pause, that was true for essential workers, but for everyone else, I think that travel patterns really began to change and shift and almost mimic that of what we talk about children and caregivers. You're not making just one trip, you're going to different locations, you're trying to get to your essential services, and you want to do that within a 15 to 20-minute walking, biking distance. And that was true for everyone now. It wasn't just children and caregivers that had that need. So I think it really started to show where the need exists in our city and how we can create cities that can be designed for the future and can address pandemics or address challenges and inequities. So keeping that in mind, NACTO put together this new resource for Streets for Pandemic Recovery and Response. It's not guidance, but what we really did was we looked at emerging best practices. We reached out to our network, not only in the North American context, but also globally, and asked cities, so like Tel Aviv, like Albania, like Tirana, that Simon will talk about. All these cities also shared what they were doing with us, and we just merely put them together and presented it to everyone else. So they had this one common resource. And what we saw was that the cities were once again turning to their streets, the biggest asset that they have in their cities, to solve some of the biggest problems of mobility for essential travel and for space. So we saw Paris implement 650 kilometers of cycleways. We saw Milan look at opening 35 kilometers of open streets. Even in New York City, there were about 100 miles in Oakland. And so all over the world, cities have been turning to their streets during this time. And I think that really shows that there is so much potential here that we have. So when looking at this new resource in order to help cities, what we've done is really classified these different ways that cities can use their streets. So whether it is for critical services, whether it's for playing, whether it's for just commuting, whether it's dining that supports local businesses, there are different things that cities can do. And this resource is available online for free. You can download it, and you can actually, cities can actually look at different ways, these different cut sheets, and use them. So I'll just quickly go over how you can use them, and so I'm not going to spend too much time on this, but the idea is that there is obviously a lot of graphical information available on what to do. So for example, here you can see open and play streets. There's of course context on when to use them. It provides tips and shares what cities have been doing in terms of planning, engagement. And of course, it really brings back all the other examples and best practices that cities have been trying to get towards. Or emerging practices, I should say. And then I think coming back to the resource itself, we recognize that cities are in different places, in different conditions, and different curves. There are some cities that are peaking, some cities that are now almost on their way back to recovery. And what we really want cities to take away from this is the principles are what they make the core and the base of this work. And I think Daniela touched on a few of those, which are also similar here. So it does say that it resonates with a lot of the work that's happening around this field. So obviously starting with supporting the most vulnerable users during the pandemic and during the lockdown, I think the essential workers have been the backbone of all countries and all cities to make them function. So making sure that the way we're designing the streets and mobility systems take them into account as cities are recovering, the transit workers, to making sure that children and caregivers have what they need, and ensuring that we are really investing in communities that were disproportionately affected in terms of in terms of the impacts of this pandemic. Obviously making sure that these are in guidance with their local public and health guidance. And then most importantly, remembering that the work and the effort that cities are putting today is planning safer streets for today, but also for tomorrow. It's not about just doing something for the time being. I think this is a moment to change something that works now, but also keep refining and think of the future of how something that can start with a cone could become something in paint and then later become more permanent and concrete. And then making sure through these efforts, we are supporting local economies because they've been the ones that have probably been impacted the most. And then ensuring that communities, children and caregivers are a part of the conversation, and we're recognizing that there is a feedback loop that city planners need to take into consideration. And lastly, I think the idea is that we do need to act now. I mean, I think to your point, Zorka, the pandemic really kind of highlighted whatever was critical, and it really kind of fast-tracked what needed to happen, and cities took action. So really thinking of how do you act now and how do you start finding space for children and caregivers. So even if it is about removing one parking lot today, starting with that, removing one parking, reclaiming that space, and then maybe tomorrow thinking of removing a travel lane, and then maybe turning it into a shared lane, and then someday just completely closing the streets. Or if you can start with closing the streets, that's where we start. And within this resource, the way we really looked at is three elements. The first one is safety. Safety is still very important. It's at the heart of it. With traffic volumes reducing, we've also seen a lot of increase in speeding. And thus it becomes really important for us to make sure that as we're designing these new streets that respond to the pandemic, we're taking into account how to slow speeds, how to manage speeds, how to make sure that there is transit protected lanes and bike lanes that are existing on the streets. So like in Milan, they have a protected bike lane, or in Auckland, New Zealand, they added extended sidewalks and ped ramps, making sure that that people had the space that they needed to walk on the streets. To Tirana, which I know Simon will discuss, about putting protected bike lanes and making sure that there is a protection as the parking lanes were converted into bike lanes. The second aspect, which I think, again, Daniela also mentioned, was the critical services. I think that there, as I mentioned, that this is the biggest public space, the biggest asset cities have, really thinking of how we can use this space to provide critical services. The distances that people are traveling are reducing, so that means that we need to make sure that the essential services are available within that walking distance, and streets do serve that purpose. So in some places where, we see the medical testing services have been erected in tents on the streets. We see, Kigali was mentioned earlier, but we see that their hygienic spots and near transit stations have been installed. Also in some, in Brazil, in a few cities, this has happened. Or for the matter of fact, just making sure that, people have access to their groceries and their daily needs, and really using streets. And this is an example from Myanmar, which I know was circulated quite a bit in the media, but it shows that there is true potential there that's been waiting to be utilized. And then finally, this one, which is the closest to our heart when it comes to children and caregivers, making sure that there's space for recreation, play, learning, gathering, social interactions that are important. So whether it's in Brazil, where they close streets for a few days, a week, to Paris, where they have used this gamification aspect to help children understand the physical distance in front of schools while they wait to enter, or in Berlin, where, the vehicles are prohibited on certain streets, and you can see how children can really take over and start to play. And this is all to say that, as we're thinking of going from this response mode to recovery mode, we need to think about what it would take for us to build the future cities and what do they need the most, and remembering that children and caregiver are still kept at the center of it, and recognizing and learning from what we saw during this time, but also making sure that we're not, the transit capacities have reduced and cities cannot continue to add more travel lanes for cars. So keeping that in mind, that transit has to be still funded and has to be at heart of the things that we do, and making sure the speeds are lower. I'm wrapping up in a minute. And finally, just to wrap up, as we're building back together, I really wanted to share this resource with you that we will launch in August, on August 7th. This will be available for free online. So we're really excited about it. It looks at the needs of children from streets and gives some key actions that cities can take. And just to end it all in the last sentence is that, as we're recovering, we need to see streets as part of this global solution to make sure that, we can provide this space for future and make sure that the recovery of this foundation, the foundation of this recovery is keeping in mind all the generations that are to come. And just to end on the note that if we really want to color the world for the young, we can start with coloring the streets a little bit, just like this picture in my background. Thank you.
Thank you, thank you. I knew that it's going to be difficult to stop you because you're so passionate about this, but thank you very much. And every time when I see bicycles, I'm thinking of, because as I said, we are in the Netherlands, the Dutch people are saying, so what? Bicycling? We are cycling all our lives. But I like the way how you were talking about taking back something that used to belong to people was taken away, and now people are reclaiming right to be in the street. So Julian, do we have a question for our
Yes, we
ladies?
do have questions, and we have also interesting comments. A lot of people are mentioning how this work is interesting, or how they've already been using some of the tools mentioned. For example, the Streets for Pandemic Response and Recovery. We'll also post the links for everyone to access later on. But in terms of
Sorry, Julian, I also wanted to say we are going to share with all attendees. We are going to share links to all these resources. Sorry.
Yes, yes, absolutely. So I had a question for Daniela and Kita, and I actually had almost 1.5 questions in a way. A question that came in through the chat was, how did the cities, or how do the cities or your organization learned about what was exactly needed from the families? Like, what channels did you rely on? How did you learn? What are the types of design solution or just solutions that you could implement in these times, considering it was an emergency response, it was going fast, and how do you modulate it as well with the epidemics? So, for example, depending on the stage of the epidemic, maybe, or in each neighborhood of different cities have different stage of the epidemic or different severity of the epidemic. How do you modulate your solutions to that? So it's more 2 questions in one. Feel free to just pick whichever part you'd like to answer most, and if you want to share a bit more about. So how did you learn? How do you learn about the needs of families, and how do you modulate your response to the severity of the epidemic as it develops?
Thanks, Julian. So I will say this is an ongoing process. So as of now, there's a few different ways. One is that in Tel Aviv, one of the initiatives that was developed as part of Urban 95 was a digital platform for parents of children under 3. So part of it is a Facebook community, basically. So there's, I don't know, around 30,000 people on it, and the parents write, and you can kind of follow online, not in a scientific way, but learning what people are saying, what their responses are. They post ideas and needs. So that was one thing that was going on during the pandemic. Another way was, as I told you before, they have a community development department, and so they have regional community managers. And so those community managers were in touch with community leaders and kind of dialoguing with them about what are some of the key needs here, and trying to assess those. I will say, just commenting on that someone did tell me that because they had to act fast, they acted on these kind of not very robust tools, and also with their own knowledge of what parents usually need, but also with the digital tools. There was a lot of, like in the live sessions, so people would write back and say, for example, that they wanted a lot more on the stress. So they said that maybe in the future, if they had done more of a kind of formal survey or something that's a little bit more data-based, it would have helped them to be more precise on the response. But of course, it was very difficult with the shutdown to do something like that. But now that things are kind of going up and down, there are more structured ways. And so also I'll mention one in the Bernard Van Leer Foundation we're using is some public space tools like from Gail. So really kind of observations and having people observe what's going on in public space and taking note, and that way finding out what's happening in addition to focus groups and surveys and other things like that. So those are some of the key ways.
For us, we don't necessarily work directly with communities. We work with cities. So I think what was interesting was to see how cities were responding to their needs. I would say that for a lot of cities, actually, some of these programs already existed. And I think what they really ended up doing was to amplify them and kind of start to like push for them with a more rigorous effort. And also answering in terms of like the public health guidance and making sure that the cities do that. That's one of our principles. So in this resource, what we really did was looked at various contexts and like what type of street, where are you based, what type of community or neighborhood you're in, and then what type of public health responses are required. So whether it is a stay-at-home order, whether it's already you've got a vaccine and people are moving forward. So really looking at this table that gives a rough framework of where and what actions you can take. And once again, to your point, like for the US, what's been different is that we've had different cities and different states have a different peak. So the stage that New York was in now is happening somewhere else. So it's also really learning from cities and understanding how the actions that they took responded. So there's a lot of fast learning that's required. And then obviously there is emphasis on making sure that the cities are reaching out to their communities. A lot of cities, to Daniela's point, have looked at virtual ways of engaging communities. Some of it has been very old school, just going out to your neighborhood main street and trying to understand what people need there, or speaking with schools and departments of education and trying to understand their needs. So a lot of conversations and kind of breaking the silos that we consistently live in is happening in cities.
Great, thank you both. So I hear basically quick answers and using the channels that you may already have set up before, such as channels directly with parents and communities like in Tel Aviv, or channels with the institutions like the schools or the departments in cities that are already dealing with these issues. So building up on those channels and trying to iterate quick solutions is the thread I'm hearing here. Zorica, I'm going to give the floor back to you to take us further.
Thank you, Julian. And I think it's a good timing for Will to step in, because a lot of comments and questions about what about the most vulnerable families and children are popping up. So Will, your organization, ARUP, you created the proximity of care framework, and we are also going to share these links after the webinar. But can you tell us more about what you did or what you are still doing to support children living in slums, in refugee camps, in informal settlements all around the world?
Still doing, happy to. Let me share my screen. Is everyone got that up? Great. So as Zorica mentioned, we'll be distributing links afterwards, but during the presentation, if you can see that QR code on every slide, if your smartphone has a browser that supports it, you can aim it at that and download our report while I'm speaking. You may know ARUP. We designed and built the Sydney Opera House, among other things. We've fielded an international development team in the past 10 years that has been increasingly looking at applying our design and built environment expertise to what we call vulnerable urban contexts, and we'll get into defining that in a minute. This year, we expanded on our partnership with the Bernard Van Leer Foundation. We had helped out with the Urban 95 initiative, and based on the success of that, we are moving down yet further in the age scale to look at a new approach to designing for early childhood development in vulnerable urban contexts. So I think it's helpful to start with a couple of definitions. When we say vulnerable urban context, we simply mean built environments where the systems are broken social systems, physical systems, political, economic systems, and where the residents are subject to ongoing shocks and stresses that prevent them from living a normal life and obtaining a normal livelihood. That covers a lot of ground, so we've broken that down into two specific typologies. Informal settlements or slums. When we use the word slum, we use it in the UN Habitat sense of a dwelling containing a family of a certain size that has compromised access to a certain set of urban services. And also refugee settlements. And you may notice that I say settlements instead of camps. The administrative and physical structure of camps is laid out to provide short-term immediate relief, whether or not it stays short-term. Many increasingly don't, but that can be difficult to intervene in effectively on the timescales of a built environment firm. So we look at refugee settlements, which are usually informal settlements in urban spaces where refugees have left a camp seeking economic opportunity. And we're targeting this work at 4 key beneficiary categories: children from 0 to 3, children from age 3 to 5, and we break that up based on a mobility step that happens around 3, which has implications for safety and stimulation. Their caregivers, optimally parents, but in many of these contexts, siblings or unrelated carers, and pregnant women. And you may be asking why a company like Arup that tends to build big, shiny white things in globally northwestern cities has this focus. Because it's a growth market, and it's the growth market. In the past 20 years, the global number of people displaced every year has risen from just over 3 million to just over 16 million people. Half of the world refugee population lives in cities. Just over half of them are children, and just over half of those children are under 5. So with a refugee population of just over 25 million, you're talking about more or less 6 million people that you can intervene to help. And these trends are only going to increase because of climate change and because of resource conflicts. Refugee flows to urban centers are projected to do nothing but grow for the next 30 years. And urbanization is going to outstrip planning, and we're already seeing that in a lot of the global Southeast. So you can think of our beneficiary category as people at the most vulnerable stage of their life, living in an environment that's most likely to multiply and intensify that vulnerability. Daniela can likely tell you more about the medical specifics of this, but the trauma that can be inflicted to a child living in a developmentally challenged area or in a relationship challenged home can persist over 3 generations. You inherit the trauma that your parents and their parents suffered. So if you can lock in interventions for these populations, you're locking in those interventions for 60 years of improved educational outcomes, economic achievement, and relational strengths. At the moment, there's very little overlap between the built environment sector and the early childhood development sector. They tend to overlap in refugee camps and disaster recovery, and they tend to overlap in a very minimal functional way. And our approach is that if you seek a functional solution, you're going to end up with a functional person. We would like to see these children and their caregivers thrive. So we've developed a framework to assess these situations and come up with context-specific interventions. In the case of vulnerable urban settlements, it's not so much about prescribing one-size-fits-all design solution. It's about making up for the lack of local data to do a thorough assessment of local needs in a ways that builds ownership and dignity in the community. Unlike globally northwestern cities, no matter how willing the current government may be to work with these spaces, there's usually a tense relationship at some level between a refugee community and a host government, and certainly between an informal community where people lack tenure and a host government. If you take the example of the area of Kibera in Nairobi in Kenya, many of you may be familiar with this because it's occasionally mislabeled as the largest slum in Africa. That may or may not be true, but it's still an area of over 1 million people that the local municipality simply refuses to admit exists. So they get no service provision, of course, but there's also no reliable census data or medical data covering the entire area of Kibera. So our framework, proximity of care, is designed to provide built environment and ECD specialists with that data. We take the approach of looking at a dyad, not an individual child's needs or a caregiver's needs. We look at the pair of a child and a caregiver as they navigate the urban framework together. And we also look at a expectant mother and her unborn child as a pair and look at their needs as well. We look at those needs in 4 dimensions. Those are health, which looks at WASH facilitation, healthcare, nurturing relationships. We look at protection, which looks at the material security and safety of buildings and infrastructure, whether spaces are accessible and inclusive, and how resilient the city is to disasters and shocks. We look at stimulation, which looks at how child-friendly those mobility networks are, whether childcare is a priority, whether it provides adequate cognitive and physical stimulation, and again, whether relationships in the home and in the community provide the adequate level of nurturing care. And then we look at support, which talks about how able residents are to access knowledge bases about early childhood development if they want to, whether those are pushed out to the community by any sort of municipal program, whether ECD is factored into city planning, and how supportive the city leaders are of ECD. Each of these dimensions is underlaid by 4 goals or benchmarks, you could say, of what good looks like in an optimal situation. Each of those are defined through 16 factors, and they're measured through 32 indicators per dimension, which gives a pretty robust holistic framework of about 128 measurable points of data across the proximity of care. Where we do this differently is that we look at all of those data points at 3 levels of the urban experience. We look at the personal and immediate space of the household. We look at the physical structure of the home and the street, relations between family and household members, and see whether the child is receiving stimulation and confident play. We look at the neighborhood level of communal spaces and public spaces, the materiality and safety of those spaces, the accessibility of those spaces, and whether there are healthy relationships between adults like clergy people, community leaders, butchers, grocers, that the child regularly interacts with but needs the supervision of a parent. And then we look at the city in a more sort of distributed sense. These may be individual people, such as decision makers or official personnel, that the child and their caregiver rarely interact with, but the policy and infrastructure decisions that are undertaken at that level have enormous ramifications for how ECD is implemented. So we look at their governance decisions, and we look at their planning, and we look at how they are modeling good behavior of reflecting ECD positive decisions for their own staff. This provides a 360-degree way to analyze any given settlement. And while we started developing this before the COVID outbreak, as Daniela mentioned, the COVID outbreak has only increased the need for it in vulnerable urban contexts, because whatever minimal resources were making their way towards informal and refugee settlements have been incredibly constrained by the needs of cities at large. And they've also increased the scope and relevance for it of globally Northwestern and first world cities, where the most vulnerable are receiving the same sort of constraints as urban budgets go towards paying off the debts that have been incurred by COVID responses. I spoke with an early childhood development specialist just last week who said that COVID was pretty much the death knell for playable spaces in city budgets for the next 20 years. And we would like to do what we can to enable people to fight that on a built environment level. So the heart of our approach is the framework, but it's supported by a modular toolkit, which we've been working with 4 organizations: VPUU in Khayelitsha, South Africa, Catalytic Action in Tripoli, Lebanon, Civic in Azraq, Jordan, and KDI, Concui Design Initiative in Kibera in Nairobi, to test and refine. Our toolkit includes a tool to assess baseline data and come up with the replacements for that missing governmental data. or more current versions of history, demographics, hazards, and basic mapping. It includes a guide for focus group discussions with community leaders and various health and education staff to understand thematic challenges in the community. Guides for individual interviews, key informant interviews to get a deeper understanding of individual concerns, household surveys and transect walks to understand the materiality and hazards that are physically present in the community, and then co-creation and assessment workshop guides and materials so that you can build a sense of ownership in the community by enlisting their aid at the design level and all the way through the build and maintenance of whatever intervention your firm comes up with, which we find results in more durable interventions and possibly provides a space for some political capital to be built in these communities and allow them to take a stronger hand in government decisions going forward. We are developing an online guide, a website, where interactive versions and downloadable versions of these tools and the framework will be available for public consumption. It'll be launched in October 2020, and we would love it if you would all visit that. There's a link in the QR code below. That will include engagement strategies, design principles, best practice case studies, and we're hoping that it becomes a hub of a community of practice where everyone on this webinar and beyond can discuss ways to further extend interventions in these vulnerable communities. Thank you so much. I'm sorry for the rushing through that, but happy to take questions.
Thank you, Will. We see this webinar as an opportunity for people to hear some new things and then come back to all of you if they have more questions. And you will find in chat and in question and answer boxes very specific questions that you might want to address later. So now time for Simon, and it's very interesting that we have comments and questions again asking how do you motivate municipalities to focus on this kind of stuff? How do we motivate them to get engaged? As far as we know, your organization has a long history of very successful cooperation. So can you tell us something about, I like to call it unexpected results which brought positive changes in times of crisis?
Can everybody see my screen?
Yes.
Yeah, okay. Hi, thanks so much for the invitation to be here and talk to you about what we've been seeing in Tirana since early March. I want to talk about bike lanes, pop-up bike lanes, but I also want to talk about the other kinds of infrastructures that are required or helpful in support of bike lanes, and which we've seen have to come about very quickly. And then I'm going to talk in the very end about kind of where we bringing this all together and where we go with it. So just a quick timeline about how we've experienced the pandemic in Albania. The March 3rd, we had the first positive test results. And very swiftly by March 8th, schools, kindergartens, and nurseries were closed. And then by March 16th, we had the first curfew. So after 5 p.m. you had to be in the house, but while you were out in the street, you also couldn't sit or be still really. So to be outside, you had to be doing something, which of course immediately play and, basically being a kid in the city is no longer officially allowed. On March 30th, and then for about a month, there was an extremely strict curfew where to be outside, you had to apply for permission via an online app 24 hours in advance. And if it was granted, one person per household would be given that permission to be outside the home for 60 minutes. So again, very, very limited ability to be outside. on June 1st, then lots of other minor changes were happening, but by June 1st, kindergartens and nurseries reopened. So that's kind of that's now we're in another kind of situation where the streets are much more open, but we really learned so much about proximity, as Daniela. So April 8th, this is what Muslim Shuri Street looked like in the middle of the day, which is when you stop to look, quite astounding. For as prosaic as it is, it's really a sort of impossible situation. And we were, we're based in Tirana, obviously, and we're also very much watching what is happening around the rest of the world in terms of responses to the streets. And it became, in Tirana, it became very clear that because public transport was not working, there's just a bus system here, planning for what would happen when things did open back up would require the bus system to have a replacement. Basically, biking would need to replace bus service. And so we as an organization, put together a memo, which we distributed to the city, thinking through the implications of the shutdown and what kinds of actions that they could take that were sort of in line with things that they already knew how to do. So it was really important for us to not try to stretch too much and make sure that these things were quite easy to implement. Another recommendation that we made immediately was that residents, especially the elderly and the very young, really need more open space options close to home for safe social activity. And this has a lot to do with all the kinds of emotional stresses that get built up by being locked inside, et cetera, et cetera. But that in Tirana and in many places around the world, quality open space is often far from where people live. You might have like one big park in town that people need to drive to, or it just takes a long time to get there. And what we really saw so obviously in the pandemic was that you really needed to be able to get to an outdoor space within about 5 minutes. In that way, you could sort of use that space, even if it wasn't officially sanctioned. Clearly, in the neighborhoods, it would be acceptable. And so those spaces were really important. And then also a key recommendation that we were seeing is that there would really be no return to normal at an end of the pandemic. That whatever actions were taken in Tirana during the lockdown would have really like big implications long term for the mobility system of the city. So the strategy talked about simply replacing parking lanes with bike lanes. And the main recommendation that we're making was saying that here's a number of streets that have a lane of street parking that could be removed. But we were quite modest in the beginning. We didn't want to kind of go push them too far. So we said, okay, take away a lane of traffic, leave the parking lane there, because we know how contentious it can be to replace parking. And then said, we were imagining there'd be kind of a phase 2 perhaps. And in that case, maybe you move the parking lane out into the middle of the street, for example, and protect a wider bike lane at the edge, thereby giving a kind of larger continuous open space in the section of the street. But basically they just went for it. And so this is what it looked like when they implemented. And I think one thing that I really want to point out is the way that it's obviously not just bikes in this bike lane. So in the middle of a pandemic, you give pedestrians so much extra space, and what you see is just sort of everybody there. And this was also really interesting for us because it really defined an urgent need for more sidewalk space too. That we shouldn't necessarily call these bike lanes. That they're I think maybe NACTO and I think some others were referring to them as rolling lanes. They were lanes to accommodate strollers, scooters, all kinds of other micromobility forms, and simply dedicated more of the street section to people not in private cars. Then this is a this is another scene which was really meaningful to us in our work on infants, toddlers, and caregivers in the public realm, and the way that these infrastructures affect their experience. Here you see a young kid on a bike with training wheels being brought down the street by an elder caregiver. And then another guy behind him on a bike, basically the total stranger, telling him bravo for riding his bike. So here you have like a real kind of social interaction, a really rich scene that was literally impossible before the implementation of the bike lane. So at the same time that we have about 15 kilometers of new bike lanes added into the city in a span of about 2 weeks, we also, it also becomes very clear that there's a real shortage of bikes. And so a kind of second pillar in a way of the kind of future of cycling in Tirana is really about the market. And it's really important that, first of all, you have different ways to get bikes to town. So we've made a couple of recommendations there as well, which talked about sort of subsidizing bike repair workshops in order to get them to sort of collect bikes very quickly and get them out into the city. Other kinds of subsidies we recommended for getting people on an existing bike share system that Tirana had. And this is one of my favorite examples of what just kind of popped up during this time is an organization called Ecovolis decided that they ought to just start building their own bikes. And you get this really beautiful sort of handmade bike that is cheap and accessible to a lot of people very fast. At the same time, talking about the market, it's also talking about bike locks, bike lights, helmets, if you're so inclined, So it's not just because there's a lane doesn't necessarily mean that it's going to be full of bikers. There's all these other issues that you have to address. A third pillar that I would say that the city was very careful about and and acted very swiftly on is kind of building up elements of the culture of biking. And this is, I think, really, really important because there's obviously we like so many other places in Tirana contend with a very strong culture of car ownership, and all that we all know goes along with that. And I think there are many aspects of biking culture. There are many angles. There are many ways to have a kind of identity as a cyclist in the city that there's a lot of people around town working toward now, and kind of helping to define and kind of put out into the public realm, into the discourse, mainly via social media. One of them is that they just have kind of influencers talking about kind of, being young and being a cyclist and sort of a kind of cool factor. There's another one which is really about kids and talking about getting very young kids onto bikes in the middle of the city on a street that's been closed down, and basically getting this idea into the public realm. And then also really talking about the history of Albanian biking, which is also fascinating history, not to mention the communist history, where there was not very many private cars even on streets. But in cities in the north, Shkodër had a biking culture from a long time. And in fact, the Albanian, the Grand Tour of Albania, or the Albanian Tour de Albania was the third such European tour after France and Italy. We've dove into kind of the supply and the culture a bit ourselves as well. So this is just a screenshot of our website that's under development right now, and we've really been quite inspired by a lot of the kind of online resources of mutual aid that have come about in the pandemic, and so one thing that we're just very, very quickly, we're trying to put this together, and we have resources like Buy a Bike, and we make a kind of just a quick kind of link to a Google map that we've produced that shows a bunch of different places to buy a bike. So just really, really simple stuff, but resources that actually kind of didn't really exist. They were just kind of word of mouth, are now online. And then lastly, I think I really want to talk about from an urban planning perspective, how to bring this all together and really think about neighborhoods, and specifically about early childhood development and the role of neighborhoods and proximity in the sort of in the interest of better brain development outcomes. And so one of the Tirana and QM and are working with NACTO GDCI on the Streets for Kids initiative. This is a kind of illustration that we're starting to develop about how these places work, and we really think of them as kind of havens of biking in the middle of neighborhoods. And what's really crucial about these projects is that they're taking place in the periphery of the city. So while there's a lot of investment in the center of town, we're really interested in getting high quality park space, green space with also kind of serious street infrastructure, like wider sidewalks and new bike lanes into these neighborhoods, and of course being very close to where kids live. So this is a school site, and there are there's something like 63 primary schools in the Tirana metro area, and the idea being that any one of them is able to be converted in this way, where you take the kind of immediate adjacent street, close it to traffic, and basically turn it into a park. So I think just kind of in conclusion, I think what we're really pushing for is the idea that biking is not bike lanes are not an end in themselves, that they're part of a much bigger ecosystem, and that in terms of infants, toddlers, and their caregivers, it's really crucial that that infrastructure is not just in the center of town and about getting forth to work, but that you build up all kinds of other ways of biking and ways of being a biker from early childhood.
Thank you, Simon. Thank you, Simon. Julian, do we have any question? And I ask for brief answers if possible.
There's quite a few questions, so I'm going to pick some, and then hopefully some of the other ones can be answered in the chat or a later stage. So to Will and Simon, it's a question around we're looking at bringing it back to the question of the vulnerable, and it's an emergency response, sometimes strict lockdown. Cities are focusing on a lot of very urgent kind of tasks. How do you then prioritize? How do you choose the right location? How do you choose the right type of intervention? How do you choose where you put your cycle lane? Or how do you, in the case of the proximity of care framework, within all of these situations where so much is lacking, where do you start? How do you choose to prioritize one thing over the next? So both about prioritizing and fitting that into agendas, and then also like location prioritization as well. Like, where do you start?
Will, do you want to answer that?
Sure. With regards to proximity of care, it can be used, the framework can be used on a citywide basis with a longer time frame for assessment to identify the areas of greatest need, depending on the challenge that you're trying to resolve. our anticipated use case is organizations that are already focused on one city or one area of a city, and finding out what the challenges are within that particular area. But our indicator structure is designed to sort of challenge the assumptions of a organization coming in from the outside who might see what seems to be an obvious need and replace those with actual feedback from the community of what will help build constant ECD progress over the next couple of decades.
Great, thanks. Simon, do you want to answer that question as well?
There's in terms of selecting where bike lanes would go, Tirana has a very unique street grid, and essentially there are very limited, like, large streets over 4 lanes in either direction, let's say, and so our I mean, the city has been building bike lanes on basically all of those, and what there was a couple left that just hadn't been addressed, and those were they were really ready to kind of jump onto those and replace them. But basically what they required was the replacement of a parking lane. And so I think, like, in many ways, it was the pandemic which gave the justification. So politically, it might have been, really challenging. These things are super sensitive. There's so much change going on in the city all the time. And all of a sudden you had a really strong justification. So essentially now you have bike lanes on the major roads throughout the city. And then now also you have bike lanes that are kind of interconnecting them. So the grid is really being fleshed out. And so in that sense, the location of the bike lanes for the most part is sort of with the approach of just kind of getting, like, anything over 2 lanes, and that would include a 2-lane street with a parking lane would get a bike lane. And what's under that can be considered at a later time, but that would be to flesh that system out.
Great, thank you. So Richard, you want to move us on? There's a lot of other beautiful questions in the chat.
I know.
Maybe some of the panelists can look at them, and I've seen Will already answering some of the questions, so encouraged to do that as well.
Because while you are typing answer in a Q&A box, I have a question for all 4 of you, and I really ask for very brief, powerful answers. Based on the lessons learned during this period, what would be a message that you would like to send to all of us? 1 sentence and a half. What is your main message? Come on, who wants to start? Daniela, do you want to be?
Yes. So I'm kind of, reflecting on what I said. I think that my main message is that community support and resilience is critical for the healthy mental health and physical health of young children and families in cities. And city government can play a critical role in structuring and cultivating such community support. They have a role to play there that could really make a huge impact with low resources going forward in this pandemic and other crises that might emerge.
So we have to stick together and work together. Simon, what would be your message?
I think really, like, be creative and figure out how to get open space close to where people live. I think there are many ways to do this, and I think that I think what we saw is proximity. It's all about getting outside in a place that's protected from cars, and that can be rooftops, that can be big shared balconies, that can be schoolyards, small parks, but really that lesson has been so clear. Whether it's a COVID-19, whether it's a coronavirus pandemic or an earthquake or any other kind of extreme situation, or just every day.
Every day.
It's all about that kind of convenience for caregivers, and that can and again, okay, last point, caregivers are everyone.
Yeah, we should all be caregivers. Yeah, Ankita.
Mine ties in very smoothly with Simon's. He's given me a good platform there. But I would add to that I think streets are, like I said, a big asset that cities have to their use. And I think that, like all the learning and social interactions and just life to take place, we've got this asset for us. And I think cities need to reclaim it and take that action and give it back to people and children.
Thank you. Thank you. People are children.
People
Children
are
are people. And Will, what would you tell us as the main message?
This dovetails with a number of things that have been said, and I think there was a question that came across saying, how do you make sure the interventions last? I would say the main message is consult with the local community at all stages of whatever you're doing. Talk to them and get them talking to one another, whether or not you're working in a vulnerable context or a first world northern city. If you're in, Cabrera or New York, the worst thing that'll happen is you'll introduce neighbors to one another and they will discover skills that can support them through the next pandemic. The best thing that will happen is they'll all have a greater sense of ownership over whatever you end up building, and that'll make it last longer.
Thank you. And that question, what can we do to make things last forever? Good things last forever, not Corona, of course, is I would like to invite all participants to go back to Mentimeter. And I also invite panelists to go to Mentimeter. I hope you didn't log out. If you did, don't panic. Just reconnect www.menti.com and put inside the code 360096. And I want you to think about two words which can describe an action or something that you think should be done to color the world for children and their caregivers. Something that you can do, something that you can contribute to. But with keeping in mind the best interest of our youngest citizens and their families. Start typing now. So what do we have? Green spaces, care, streets as play spaces, enthusiasm. I don't know how did you manage to put 3 words, but it's nice. Maximize open space. Playable urbanism. Does it mean that when we put early childhood lenses, everything can become a place for play and joy? Empathy, yeah. Stimulating places, culture, hope, open spaces. We need to collect also real data. But the main two messages are streets as play spaces and care. So I think this should be a message that we have to commit, that we are going to do as much as we can to create streets as play spaces, to care about the needs of the youngest and their families, and to continue working on that. Maybe we will have communities. So we are at the end. So I would like to say thank you to all of you. Dear panelists, thank you so much for your time, for your contribution, collaboration, and for your passion and dedication. It's something that we really deeply appreciate. And I hope that today you managed to push us all to think at least a little bit out of the box. To participants, I want to tell you thank you so much for being part of this webinar and for investing your time into your professional growth. And let's continue the conversation. You will find soon in your inbox recordings and further reading materials, all the links and everything that you were asking for. You can ask us on you can find us on Facebook, you can find us on Twitter. And goodbye, stay healthy, stay safe, and have as much fun as you can. Bye.
Thank you.
Thank you all so much.
Thank you. Bye.
Thanks all.